California, and I'm going to talk to you guys tonight about temple scars. So I know it's an election night, but we're going to really focus on just being better people and just improving ourselves, and really worrying more about just the ways that we can unlock our full potential. And sometimes things like scars can limit that. So we're going to talk a little bit about that because I think that's going to be more valuable for a lot of patients. Sometimes people, get anxiety during this time of year, a lot of emotions that go through, but the sort of thing with election is like it's out of our hands. And at this point, these are the things that we can kind of work on and improve. And part of what I try to do is just to try to get it so that people can work on getting the parts of their body or their face that they feel are holding themselves back, and get it so that they can really achieve another level for themselves and continue to improve and not have anything really limit them going forward. So that's part of what I'm going to talk about today. I'm not really, somebody who gets bogged down particularly with like just the macro issues sometimes, because I do find that it's important. Like I care about it a lot. I care a ton about it. Like when people are not reaching their full potential, it really affects me. And or there's like a lot of violence that occurs to people and things like that. I'm not saying like don't pay attention to it, but like at this point, like it's really out of our hands. And so it's sort of like, let's take a look and see kind of the things that we can control. And part of that is really like, with this, with our body, with our mind. And in this case, what we're working on is with scars, which I think could really limit people's potential sometimes. And let's kind of go through a little bit of the things that we could do to improve it so that you feel more comfortable and confident. And no matter what happens, you sort of realize that there's ways and solutions. And you don't feel like this is an added stress in your life. I want to have people feel that way, because it's like sometimes there's so many external factors right there, and this sort of feels like this extra burden now, and it sort of like hits this like crescendo where it's like everything is okay now, sort of like immediately now you have another stressor, and now everything kind of gets blown out of proportion. Everything feels really terrible for you. It's sort of like allergies. I don't know if you guys are familiar with allergies, but like sometimes people are allergic to like mold and pollen, and also like pets. And normally they're fine because the mold and the pollen is relatively under control, but suddenly you add like a pet to the mix, and now everything gets inflamed and everything like that's really, really terrible for you. And anxiety works like very similar to that. And that's why I focus a lot on this, because sometimes what ends up happening is that people's lives are relatively stable. It's okay, because even though they have some stressors, it's like there and it's managed. And now something new has just come out, because potentially you lost a lot of volume in your mid cheek, for example, or your temple area for this patient, for example, and it started to bother you and stress you out a little bit, that now you have that and you have that volume loss, and you see scars now. So it's like, let's do something at least for that portion of things, and hopefully the rest of your stressors get under control a little bit better too. Hannah saying they recommend a CO2 laser, but I don't think I need to do my whole face for pitted chicken pox boxcar scars. I wanted it, but the place I said to go, no. So Hannah is saying that she wanted to do TCA cross for pitted chicken pox scars. And the place she went to said no, they recommend a CO2 laser. So laser is actually not a bad idea for boxcar scars, but it's not really probably the only thing that I would do. Sometimes you would actually do more with sometimes like a little bit of filler, like Bellafill or other fillers really. You want to do something really to revolumize some of that area, do a little bit of subcision and a little bit of a laser to help soften it. That's actually okay. So if they're comfortable doing your skin type, Han, I believe you're Asian descent, if I remember correctly, and potentially could cause more risk with that. But if you're, if they're comfortable doing it with you and they could do boxcar scars like that, that's fine. If it's relatively deep, you may have to do excisions though. You may have to do other things. So that may be that. Big D saying, Doc, I will be in soon. One more year. Awesome, Big D. Look forward to it. I loved meeting you the other day, like a few months ago. Whenever you're ready to do it, we'll do it for you. Let's see here. Lilies and Fox and Flowers is saying, what is the best filler for volume loss for chin recession? So you really want to get something that's a little bit thicker, so something that's going to give you a little bit more volume. I don't actually use the Juvederm line of products really, because I find that there's a bit more Vicross technology that could cause nodules. In fact, a patient I worked on the other day had some nodules underneath the eyes. In the bone, it's less chance of that, less risk of that, but still, I just don't really love it for that reason. So I usually use more, if I'm using hyaluronic acid filler, I'm using more like Restylane Define. If I use something with a little bit, if you want a little bit more thickness, I can use Radiesse, works really well. And for more longevity, Bellafill could work well. Sometimes I do both like hyaluronic acid filler and Bellafill for that chin. It works really well for that. How do I get rid of keloids? So good question. Keloids, I do a lot with keloids actually. I really like doing keloids. I appreciate the question because it is something that's really difficult for a lot of patients, especially in certain parts of the body. I'm not sure where your keloids are located. But if it's on the shoulder area, for example, really challenging for a lot of patients because in this area, if you're wearing clothes, that friction could be a little bit painful. On the chest, it could be a little bit painful for patients. Sometimes I see it for men along the jawline as well. That's where it's basically like this angry red color, and that's really like the standard raised, thick scar. And sometimes what you have to do is a little bit of a steroid injection with something called 5-FU. And you may try to do that, especially you said in the chest area, you'll do that there. And if it's more like red and angry, you can use something like XLV. There's other options. You could always do something, other immune suppressive medications. You could try those, but actually you get great results with this way. It works very, very well. And then as the redness starts clearing up, sometimes there's a little bit of hyperpigmentation. So you could use more like a laser, like the Pico laser now to help with that. Caleb is saying, I have keloids in my jawline due to acne. Caleb, what kind of razor blade are you using? Because sometimes electric razors, it could happen like that. One thing also, by the way, I should have mentioned to you earlier for keloids is to make sure you're using silicone tape. It's really important, not the cream. I don't think the cream is really particularly effective really, but using silicone tape actually really for about 6 months as you're treating it, really useful to help keep it flat. So that's one of the biggest things I should use, silicone tape. A lot of my patients know I do a lot of silicone tape, especially when we're doing scar treatments where the scars are really thick around the edges there. For hypertrophic scarring, after I smooth it down, I insist on using silicone tape and try to get it down for as long as we can, because then there's a lot less friction there, a lot less chance of that scar contraction to happen afterwards there. Anas is saying recurrence seems to be an issue for keloids. So exactly. So that's why really doing things like silicone tape are really a good option there. Let's see here. JT is saying, I have those scars. How much is the treatment? Well, this was mostly TCA cross. We did do laser for him as well, and Bellafill. And most people would be about, for this kind of location, for these kind of scars, would probably be close to about $3,000 or so for that, potentially a little bit more depending how thick it is and if we need to do more, but around there. Let's see here. Life with Glenda saying, I'm going to make an appointment to treat my smile lines. I'm 5 hours away. Appreciate you. Really do. My patient today flew in from the Bay Area just for me to evaluate his skin. He did have very complex scars and we were able to go through the whole treatment plan. We could do virtual consultations as well, go through things really well in depth with photos and really see what's happening. But I really appreciate that a lot of patients come from far away, out of state, and in Northern California for us. And I really take this very seriously. I'll tell you that really honestly. Everybody always says that or not everybody, but a lot of people have gone through so many different people. They tried so many different things in their journey. And it's I take that responsibility extremely seriously. I'll tell you that right now, really clearly. Anybody that goes through it with me knows I really will take it very seriously. The amount of work that you put into and time invested into it, money that's invested into it, I'm fully aware of all an emotional journey that's involved with it. And it's like I'm fully aware of all that you have to do to do this. And I know for a fact every single day I feel really comfortable in knowing that I really did put my time and energy and put really everything I needed to do to make sure that patients get excellent results. I really do. And so it's very important for me to be able to do that. And I love it. It's really amazing for me. Like I love that. It's actually like therapy for me. Seeing people's results, seeing like this patient's result. He's so happy and so excited. A young gentleman who had such severe scarring in the temple area. And now he's like so much more comfortable and confident. It's really, really nice to have that. It feels so good. And I want that. Like, I want that all the time for everybody. I want like humans to really achieve a lot more than we're achieving. I want that there's less of a system that's preventing us from achieving that. And part of that is in my world and making sure that the things that I'm doing are going to help you do that. I want that so that you're not going to be burdened by anything like scars in the future. You're going to really feel really good and comfortable about yourself. It's super important for me. Scylla is saying, I live in Canada. I want to do my acne scar journey with you because a lot of people didn't care for me. I appreciate you, Celia. I have a lot of patients in Canada, a lot of patients actually. I'm more than happy to help you with that. So, you know, it's amazing. I appreciate you. Like I said, I'll take it very seriously and help you with that. Sam Cake is saying, Doctor, I have a question. I got recommended Bellafill for my acne scars, but I don't feel comfortable with that. Is there any other alternatives to that? Sam Cake, are you one of my patients? I can't remember. The name doesn't sound familiar to me, but if you are, we could see what the options are, what kind of scars you had. Let's see here. Zymora is saying, do you work with sun damage treatment? A ton of that, a ton. I do so much of that. We'll show some results this week as well. Some people let us share this week, so hopefully we'll be able to do that. Zymora is saying, do you work with, oh, I already got that one there. Let's see here. Did you do dermabrasion on him? It looks like that, right? No, actually I did it, in a way it is, but it's not mechanical dermabrasion. I used a laser to really smooth it down. So I smoothed down the scars with laser, softened it up really well with that, and it ended up, making it appear as if it's a dermabrasion result. Really happy with it. He's super happy with it. We do need to do a little bit more TCA cross just to continue to improve things. It's going to get better. Sam Cake is saying that they're not a patient with me, but they were recommended Bellafill. So, I mean, I personally love Bellafill. I think it depends on how people are doing it. I have seen some people who are really reckless with the way they're shoving it in there, and they push it in there and like really, it's sort of questionable. I would never get Bellafill with those people. So sort of look and see like how it's done and like the afterwards, how it looks. And make sure that it's done at a really appropriate level for yourself. If you're not feeling comfortable with something that's a more permanent product like Bellafill, then you could consider doing like Sculptra or Radius. That's a possibility. But if you like, honestly, the truth is though, if you feel like you're not comfortable with the injector doing the Bellafill, then probably you should avoid all the products for that though, if that makes sense to you. Really, it's not just a matter of a Bellafill issue then, really. If you're not feeling comfortable, you're really not feeling like you're gonna be able to achieve the best results, or you just don't feel like it's gonna be safe enough for you, that's okay. Just consider going to somebody else that could do it really safely for you and that you could feel really comfortable for you, because that's so much more important in my mind. Let's see here. Do you know what could be the cause of getting burned with Morpheus resurfacing? I am Persian. Yeah, I do. I mean, basically there is a resurfacing tip that's with Morpheus 8, which was touted to be as an equivalent resurfacing agent similar to CO2 laser. And the truth of the matter is that you can get still a lot of post-inflammatory hyperpigmentation with it. You do want to pre-treat the skin, especially you said your Persian descent. So, Iranians really do have pigmentation which could come out after energy devices. And so you really want to make sure that you're suppressing that as well as you can beforehand, and then you have to do it later. And you're saying that it left you scarring. So Morpheus 8 caused post-inflammatory hyperpigmentation and scarring for this particular patient, and it was likely the resurfacing tip. I've talked a lot about this, so I have a lot of different tools, including something like Morpheus 8, and I don't run into any problems like that. But it's certainly available in so many different practices. I'm fully aware of that, and I've talked to people who do it on maximum settings and really like sort of brag about the fact that they do maximum settings for these things, and it's really reckless. And they do it even on patients who are Fitzpatrick 4 and above, and you really could run into a lot of problems. If you're not like burning the patient, you're probably going to be like destroying some fat the way that some people do it. I have a patient that came in today. I don't know if you're on tonight, but she did TCA cross by somebody who I'm familiar with and who I've dealt with many times, because this particular practitioner has burned many people before in the past. And this poor lady came in and she was burned from TCA cross, and it's unfortunate to me, really, really unfortunate, because I know that like it gives something like that a bad name. It's like she now has burns that I'm going to work on and improve, and worse scarring in her mind. It's very clearly was done in a way that was sloppy and not appropriate for this particular, she's an Asian patient also, and it was not done appropriately for her. And this is stuff that I think, pay attention to these things, see who's doing it, see how their hands are, see what they're doing, and really feel really comfortable about the person you're going to for these things, because these are risky procedures that, people say, oh, well, let's get TCA across and do it at home and see what happens with it. And yes, you could get some improvement for it. And some people will claim they got improvement for it. But I see so many of these burns and so many problems. And I see it sometimes in even people that are going to dermatologists and other practitioners. And it could be sometimes catastrophic for the person. Sir, we can be able to help them out with things. But in the meantime, while we're working on it, it's your scars are worse, and it's really distressing for people. And I hope we could solve that. It's so hopefully you guys can avoid those type of things. And so I've always talked about, there's some things that I really try to talk more about on here because I want people to be aware of it. There are some people who do it very, very well, and pay attention to that and go to that kind of thing. I'm not saying I actually am okay. It's not, and actually people get very confused about certain things. People think that everything is about competition in this world. And I think there's a way to kind of really shift things. You really don't have to have this concept where things are just as competitive as you think they are. I'm more than happy with collaborating with people and helping people and teaching people and working with people that are doing things ethically and properly. And I do it, actually. I do a lot of people, and I've showcased to a lot of people who do it that way, and I trust and with their hands, and I know that they're going to be okay with things. But there's a lot of people that just aren't particularly good at stuff, and they really should be doing other things. It's this is not particular, you likely do not have the hands for certain types of procedures, or potentially even you don't have an aesthetic eye for even, fillers or Botox and things like that. And it's not really you really shouldn't consider doing this. I'm not saying this in a way that I'm just trying to put down my competition, because actually I'm okay with training people who will be competition. It's okay, because actually I want more access to this stuff. I am somebody, I've said before, really my goal in life in the world is for people to achieve the best possible version of themselves. I want people to continue to rise and continue to grow. It's really, really critical for us as a race, as a people, to just continue, as a species, I should say, to just continue to get better and better and better to achieve everything we could possibly achieve. And part of that is that I do my job in making sure that you guys have the tools wherever you are to be able to do this safely, so you don't have to worry and this doesn't hold you back from achieving that. Because now, this poor patient who ended up having, a TCA burn, and now she's now set back now. She was going into a person and it was a dermatologist, and now she thought that this person could do TCA cross, and now she has severe burns on her face, and now her progress is set back. And I take this super seriously. I told you this before, but I'll say it again, that I really, really do. I really care about us just getting better and better and better and better in this world. And so that's where this comes to. I want to keep things as safe as possible. Let's see here. Gentle Jules is saying, love your social media work is amazing. Appreciate you so much, Gentle Jules. Thanks for reaching out again. Steph is saying, thank you for your videos. How many CO2 laser treatments are recommended for acne scars? Good question. So it's not about how many you're doing. Really, sometimes it's just one or two. I don't do a bunch. Anybody who trains with me or works with me knows I don't do multiple passes. I don't do very aggressive CO2, actually. I'm not the guy that does a bunch of crazy wild CO2 results and tries to claim that these results are from CO2, because I am a strong believer in doing manual work, doing things with my hands, doing things like TCA cross, doing things like subcision, doing things where the laser is really precise. In certain parts I'll go strong, but then a lot lighter everywhere else. It's extremely precise. I go down to 1 millimeter and just slowly and keep on working down the edges of the scar. Anybody who watches me knows that. Actually, the dermatologist resident who's working with me right now, he was amazed at how long I'm taking just to smooth down a single scar edge. I just kept on going at it because the patient was darker patient, and I needed to make sure it was super safe for that particular patient. So I just kept on going, kept on going, kept on going, kept on going. And the thing is that honestly, maybe there are other people out there. I'm not saying there's no one, but like, I don't know anybody with more willpower than me. Like, I never met anybody. So I will just keep on going through things until I get that, the result that I'm trying to achieve, and keep on doing it and keep on doing it, keep on doing it. And it's like fun for me and it's not boring, and I'll just keep working on it. So this light just actually died. So that's where we're at. Where was that thing question here? So somebody was saying I'm not answering questions. So let me get to that here. So what questions are you looking for? Let's see here. What is better to promote collagen, dermabrasion or acid peel or microneedling? Well, it's different. I mean, those are all different things. There's, there's not going to be much collagen production with microneedling. It's mild. I think you could do a little bit of collagen production, but not too much. Dermabrasion is going to smooth down scars. It's really not really like a volume, a collagen response type of thing, a little bit, but not so much of that. More with like lasers, that's going to help. Collagen stimulating products are going to help. TCA cross is going to help. That's probably going to help out a little bit more. User 58 is saying, do you ever see patients get new scars with some subcision entry points? I can say really clearly, it's difficult to say, is it possible from other places? Maybe. Like I've never seen a burn like the patient that I've been seeing for these TCA burns, but like I never had that problem. But I never also had like new scars from subcision. Like this patient did subcision, there's no new scars. So it's like, I never had that problem there. Let's see here. Is subcision safe in the jawline? What I end up doing is actually more blunt cannula subcision there. I usually don't use like sharper tools like the Arterial Liberator along the jawline. So I usually don't do that there. Hopefully that explains it. But I could go through and show you some jawline results. Maybe tomorrow I'll do that. But it's a process that I think you could do very, very safely, but you have to really be patient with it. And I was talking about this today with the resident that's with me. He's actually a DO just like me, which for those who don't know, it's like we're physicians. We do exactly the same training in America for as a physician, as an osteopath. But one thing we do, which is kind of interesting, is that we use our hands a lot during training for palpation purposes. So we actually do feel a lot of the skin. So I do think that it gives us more feedback than a lot of other practitioners. When we're feeling the skin and we're doing subcision, we can really feel the tension areas and we can really make sure that we're breaking down the appropriate areas there. And I think that's probably one of the key differences really for us with subcision, especially for myself. I could speak for myself, and I'm just really careful and just slow, and as I'm doing, I'm just keep on moving it, keep on doing it without just being reckless and wild like the way some people are. Some people really do just go wild with the stuff, and I see it myself, and I'm aware of it, and I'm aware of the complications. One of my patients yesterday, he went to somebody who was using their own version of like a Taylor Liberator that they said that they invented, and the patient has some sagging. So it's like it's possible it's from this area because the way that they did it potentially caused that there, so it's like they also combine it with like Sculptra, so maybe that's the reason. But like there's different ways of doing this thing, and there's ways to do it safer, and I'm very, very safe as I do this. I think that I could achieve excellent results without trying things and being risky for patients, and especially my patients who are darker skin type. I really want to make sure that we're very, very safe with them, and we're not actually overheating the skin. We're not doing things that are going to prolong the healing process. I don't want pigmentation issues. I never have prolonged pigmentation like that. I always try to solve pigmentation issues. We prep the skin so it's solved. And I'm doing very dark patients, darker than a lot of other people. And people get confused about that, that I'm able to do that. But I tell people I don't do as aggressive of laser on these scars in general, even for like anti-aging, like certain localized areas you go strong, you could go a lot lighter elsewhere. And I think that should just be clear for people, because there's a lot of I guess I should say a cultural change that needs to happen with the way that we're taught about how you should be doing lasers. Everyone sort of assumes that it has to be like your full face is just fully crusted and things like that, but maybe it's better for people and you're going to have less chance of damage, less problems if you do really focused on things. It takes more time. That's the thing that's a problem for people, that it requires an enormous amount of concentration, an enormous amount of focus to be able to do. But the thing of it is, I actually love that. It's actually like when on my time off, what I do is I spend my time like building things and being like focused. It's relaxing for me. I like that. It's actually really good for me. So I like that. I like being like super concentrated and super focused on a project. It's like really fun for me. So I don't know. Are there other people out there? Maybe there are people like that, but like, I know I'm like that. So it's pretty cool. Like I like that. I'm like just sitting there and it's like, I sit there and I keep on working, I keep on working, I keep on working, I keep on working. Well, other people may look at it and like, man, this is like pretty monotonous that this guy could just keep on doing it. And I just keep on going at it because it's like, this is like the end result is going to be awesome. And I always think end result type of things. Like where is that hockey puck going to go? To quote the great Wayne Gretzky, he said, you basically anticipate where it's going to be going, and then you don't actually. So it's all. The point is that I kind of messed up that whole analogy, but the point is that you really don't want to actually like be bogged down in thinking monotony. Like if the person is doing the lasers, thinks that things are monotonous, you're probably going to get boring results. To be honest with you. But you're going to get more fun results, things like that, by people who love what they're doing. And I love every single thing that I do. I love doing filler. I love it. I love doing facial balancing. I love doing scars. I love doing pigmentation. I love doing all those things. It's like really fun for me because I could see where that journey is going to go, where it's going to ultimately be. So it's like I could like envision it in my mind that this is going to be really cool. When I was doing this patient's scars, I envisioned this result and I got it. And man, it is a lot of satisfaction to have that. Like it's really nice to be able to see that, like what I envisioned like that. You miss 100% of the shots you don't take. Michael Scott. That's awesome. Yeah, I love that one actually. Let's see here. Is there risk of infection after CO2 laser? There is. So it is basically going to burn off most of the bacteria on the surface of the skin, which is good. But later on, as you're healing, it's a wound, it's a burn. So you're going to have to do things to help prevent that from turning into potential infection. I've actually dealt with patients who've consulted with me because their practitioners didn't do any antibiotics or didn't do anything else afterwards, and they ended up potentially having some scars. So I worked on that for them. What do you do about double chin acne? I'm getting confused with that. Double chin acne, or are you talking about chin acne? What would happen if you get infection? Well, we try to manage it really quickly if you do, but there's different ways of doing it because you really want to prevent scarring. So appropriate antibiotics. I'll tell you, to be totally honest with you, a lot of people do not do appropriate antibiotics just in general, like even for like mild illnesses, the sinusitis, things like that, they don't do it actually. And it's like really unfortunate that they don't have a proper understanding of antibiotics. Fortunately, one of my big pet peeves in life was always like appropriate antibiotics use, I found that a lot of people weren't doing appropriate antibiotic use, and so it was like really like something I cared a lot about. And antibiotics was like something I take care of and make sure that people are really safe and we can manage infections there. Excuse me, do you have Spanish-speaking staff at your clinic? Yeah, about half of our staff can speak Spanish fluently. Damn, you're committed even on election night. Yeah, I am committed. Someone was asking, did I vote? I did vote. Like, it's, to me, I'm more about like the system though. I really am. I've told you guys that before. I don't know if anybody was on here that day that I was talking about the election stuff. It doesn't really affect me too, about the different presidencies and things like that, because I think the system, it really needs to change completely. I think like every aspect of it, really the whole aspect of the system is terrible, and it really oppresses us and prevents us from achieving our full potential, really. I do. And so it's like, I look at it that way, and I think to myself that like what I would do for a lot of this is very different from the candidates would do. So personally, that's how I look at this. I look at this as I really believe that people should have universal basic income. Like, I care a lot about that. I want everybody just to be like really comfortable, and I want like scars to be treated by like insurance. It'd be really nice for me if like insurance could be like covered, would cover scars and would cover like all sorts of acne treatments better. I start patients on like certain antibiotics, and it gets rejected by insurance companies. And like, that's like really unfortunate to me. I want that all to change. I want that whole thing just to get better for everybody. And like, it's just like, yeah, you have the ability to do healthcare for like very, very cheap, and you could take care of it so these scars don't happen like this. I want so that you have access to care, to the healthcare system, so you don't end up with these kind of scars. One of my patients earlier yesterday, really severe scars, like some like significant scarring. He's like in his early 20s, and he said that he tried actually to go to physicians. It was very expensive for him to go to physicians, and then it was like nobody was providing anything. He was going to so many different creams, spending hundreds of dollars on doing creams, and he had severe cystic acne, and it was just delayed and delayed and delayed, and he left with, like, in his 20s now, severe scarring. So it's super important for me that those kind of patients get really appropriate management, and then medications are cheaper and more effective, and just the effective medications are cheaper, because right now it's like you could prescribe certain creams for patients and it gets rejected. And it's like, I wish I could do that. Mara is saying, my insurance paid for my antibiotics. See you Tuesday. Awesome, Mara. Look forward to seeing you actually. Alan is saying, awesome, Alan, good having you on, by the way. Alan is saying that he also wishes that. So Alan, you're saying that basically you had problems with insurance issues, and that's why you had the scars. Is that what happened there? So I wish that didn't happen, really, because it's like the scars that someone like Alan has, it's like it could have been avoided if we were able to handle those scars and tackle it in an appropriate way. So it really, like, I tell patients all the time, like, I do have a lot of different devices. I do love the Acure laser. Someone was asking about the Acure laser. I do love the Acure laser, but I'm more than comfortable and happy if you do something that's whatever you do to control your cystic acne. I just want your acne under control. Even though I do scars all day long, I don't want you to have new scars. And patients that don't have scars, I really don't want you to get scars. I really want you to avoid the whole process that it takes to get scars. I really do. It's a lot for people. There's a lot involved with it, and you could potentially have, like years and years of scars before you see me and I work with you. So it's like, I really hope that we could avoid that. So take it seriously when you have cystic acne. Go appropriately to the people that need to treat it, and hopefully get access to it. Hopefully it's not an issue because you can't afford it, because that hurts, honestly. It really does hurt that that's the situation. And I hope there's a way for you could afford those treatments, and then be able to get the appropriate products and appropriate care for your skin, so you don't end up getting scarring, which ends up being a lot more expensive and a lot worse, a lot more difficult and longer for you to treat. Steph is saying, I'm going to go start a GoFundMe so I can go to you. I admire your work and love that you're so passionate. Steph, I appreciate that, really do. But I will say this though, honestly, I do appreciate all those things. But I've said before on here, I'm not doing saying this just to say it, but really come to this really more at a spot when you feel really much more comfortable that you could afford things, and you're not going to be stressed about it, really. It does get expensive, and it'll be really, really nice to be able to treat you and manage you. But I want you to be able to be at a spot where it makes sense for you, and then I'll do my job and get you through the full journey and get you really, really great results. But I want you to feel like you're not stressed to be able to make ends meet to do this. We will be able to work with you. There's going to be ways to do this, and just come to us at a spot where you feel like you are there financially. Otherwise your life is under control, and there's not external things that are really going to make it so that it's going to be really a stressor for you to take a week off of work or so. It makes sense for you. It's I want you in a spot where it really does make sense. And when it does, like this patient, for example, it's awesome. It's an awesome result. And like Alan was on here just earlier, Mara was on here earlier, all patients of mine that have done a bunch of treatments elsewhere, did a bunch of things. And finally, they both come from really far away. I think I saw another patient that was on here as well, that, they come from far away, they do it, and we get there. We'll get you through the process to get you really amazing results. I want to be able to do that. I would love to do it. Just do it when you're feeling like you could do it. And it makes a lot of sense for you to do it. So I'm happy to do it though when we get there. Dark is saying, do you treat ice pick scars on the forehead? Yeah, absolutely I do. I do mostly TCA cross. And a lot of times in the forehead, you do want to do some subcision. So you go in there and break up the scar tissue. And you may need to do a little bit of filler there. So you may need to do all those things. Do you perform mole removal? Yes, we do. Yeah, we absolutely do. But it depends on what kind of mole it is, though. If it's a little bit suspicious, we may have to do a test. I will have potentially a partner do it, or have you go somewhere else to essentially go and do a biopsy if it's needed for that. Stay True is saying, wish a Cure laser was covered with insurance and breaking out so much less with the Cure. Awesome, Stay True. I'm glad you're working that. It'll be something amazing for everybody if everybody pushes something like that getting covered by insurance. Part of what I try to do is actually try to get as much of the data out there so that people know about this. And then hopefully there could be some pressure on insurance companies to cover it though. I don't take insurance right now, but like I'll be happy to. If insurance cover this stuff, I would love for it to get covered by it. It'll be awesome for it. It'll be great if more people could get access for it. People have insurance and they want to work with it. Honestly, scars are a pathology. You're smiling. When you smile, you're stretching out your skin. Sometimes it does cause a little bit of sagging, but also there's this emotional component to it. There's this mental health component to it that it really should be something that's covered by it. It really should. It should be treated like you do any other reconstruction. And this is really more like reconstructive type work. And so it's like, it's not your fault you got scars. Like the patient earlier, Alan, was saying he didn't have access to appropriate care when he was younger. And now he was left with the really severe scars. And it's like not his fault that that he didn't have access to that care. Not his fault at all. And I see sometimes those comments on like my social media and like when we post sometimes, and someone will say, just stop picking your face or stop doing like, stop doing something else. And it's so unfortunate that in this day and age, that's still like pushed out there. There's still this thought that like, it's because you picked your face or because you didn't wash your face well. So many people are like insisting that that's the case, that there's like an issue with the fact that your face wash or something like that. And honestly, vast majority of people have tried pretty much everything under the sun. And I know that there's certain triggers. I know certain things can make it worse. I'm not denying it. Actually, I love actually talking to you guys about like the diet aspect of things, the things that potentially could be triggers for you. Like ask me, I'll like potentially like go through a whole list of it or try and point you to a direction of where to go for that. But let's say all things are under control. You're not doing any of those things. You still could have breakouts because your hormones fluctuated, and that's not your fault. And like you could go because you're stressed out right now this week or something like that, and you have breakouts now, and it's not your fault. It's like that's what it is. And like I hate the fact that people judge people for that stuff. It's just ridiculous to me that like in this day and age, people put the blame on the patient, and instead of looking at like there's a disease process, so nobody like blames people for like other stuff. It's like you're not like sitting there looking at like, oh, this guy has a congestive heart failure and it's because he did this, and it's like so useless and silly to do that. Anyways, so like try to like focus on like improving the heart and working on it and giving the appropriate medications for that and giving support. Like I'll do my job and doing the treatment stuff, but everybody else, and vast majority of you do, but like everybody else really could just do a good job of just supporting people as they go through that journey. And like if you see like your coworkers going through these things and working on it, and or like your spouse, my patient today actually will show you her results. Her like husband was saying they didn't see enough of that they thought that there was no difference or something, and she's like, I do see it as really nice and all this, and then she saw it. She goes, I'm going to show my husband that. And so it's like sometimes just more support for these things as you go through it. Let's see here. Talk about Bellafill. Bellafill is actually my favorite product. You guys know I talk a lot about Bellafill also before because I am full of Bellafill. I love Bellafill, and if you ever want to, I'll let you touch my face. You can feel it's soft. It's just like real natural skin. I know there's so much information out there. There's so many people who are concerned about Bellafill, and I do say that if the practitioner is not comfortable doing Bellafill, they shouldn't touch it. If you are looking at the practitioner and they don't look natural and they look overfilled, don't do it with them. But it could be really amazing. It could end up being an amazing product for the right patient, because I found it really was, for me, it really was just the fountain of youth. It really was. It's like the product that really did reverse aging. So it was like 5.5 years ago, we started that process, and my skin is better today than it was like 5.5 years ago, which is amazing to feel like that. Yes, I have done lasers, but just the volume that's there, the way it is, it's so different compared to what it used to be even. And it's fun. It's really cool to have that. And that's why I talked about it. Like I'm happy. Like I do like other products too, but it's like an amazing product. This particular patient, we did Bellafill for him, looked incredible, right? Like the temple area looks incredible with Bellafill. Just take a look at that and you'll see it's like a really amazing for the volume, for the collagen response. And the best part is it gets better and better over time. It's really unusual like that. And it's a little bit confusing for people because it really does. Like I know for a fact, my skin is more firm now than it was before. That's pretty cool. How many other treatments can say that? That's a pretty cool thing to be able to say. Dinah is saying, is Bellafill better than Sculptra? Good question. I mean, I think Bellafill is good for like more localized areas, like for example, the temple area. It's really good for that. Some areas that you want to do some volumization, it's really good for it. The way I do Sculptra is really different than you'll see pretty much anybody else do it. I usually do it more on the bone, and I do get some collagen production with it. I also improve a little bit of the bone as well while I'm doing it that way. So I'm going a lot deeper than a lot of practitioners do it. And the Sculptra works incredibly well that way, I find. I find it a lot more effective. It looks a lot more natural that way. I know a lot of other people do it more where it's like very diffuse, but the way I do it tends to be it's like deeper and just really down to the bone. And I just sculpt out the face that way. And I don't tend to use as much as they sometimes push. Sometimes they really say, you know, it's per like decade, you need that many vials or so. Like not like 40 vials, but I mean, but like you would do like, let's say you're in your 40s, you may need 4 vials. I definitely wouldn't do that like that full day. Like I may space that out a little bit. Maybe eventually you need that, but like initially I'm pretty conservative with it. And even with something like, hyaluronic acid filler, I'm very conservative with hyaluronic acid filler. I go and do it where I do certain select spots and I really build out those areas, a structure for it. And then I say, come back in, we'll see how the swelling goes down. We could do it again. Most people are very happy with where it's at right there. You know, I've talked a bit before about it, but a lot of people say that you're doing these things that last a while and isn't that bad for your business? It's not, because it's actually amazing. It's amazing because I get to see these people, these patients, and I walk around like Trader Joe's or Whole Foods or like the park or anywhere else, and I feel really good about the fact that they look really natural compared to like maybe I was walking around like another mall and the people didn't look that great. I walked into a restaurant the other day and like, you know, it was like really a lot of pulled back look and like really overdone lips, and like it just didn't look great to me. And like at least I feel really good. Imagine if I walked into the restaurant right over there and I see my patient and now she looks like that. Like I just feel really like bad that I did that to someone. Like just like that's not something I'm going to be proud of. So I'm like really serious about making sure this looks really good, because I want it so that people know that there's a way to do it really natural and soft. And I want that like everywhere, where I feel really comfortable. If I run into patients, like you're going to look great and I'm going to be happy with that. So it's like I want that for myself too. Like I want you to look really good so that it's like this is my work and it's amazing and it looks really natural, untouched, and awesome. And we're both really, really happy with that. And you know, nobody else needs to know about that. Awesome. That's really great. That feels really good in life, at least for me. How about neck tightness? So face tight, neck tight works well. You could also do something like Renuvion works well for that. Actually, dilute radius is really, really useful there, especially when there's volume loss. It could actually work really well. I love it, actually. I love doing dilute radius in the neck. It helps with like those tech lines. Everybody's just looking down at their phone. You know, I constantly kind of have to like remind myself not to do that. And it's like, you know, you're doing that, you really are causing sometimes these wrinkles there. But radius is a great way to reverse some of that damage there. Stay True is saying, what do you think about an acne vaccine? Heard UCSD is doing research into it. Yes, we did reach out to them a few months ago. There were hopefully one day potentially could be on a site for them, hopefully. So let's see. It'll be really nice. I would love to be able to get involved with that. I will love that. Like I will absolutely love acne to be solved. Whatever it takes to get it solved would be amazing for me, so that we don't have to have scars. One of the biggest things ever for me in life will be if the new generation doesn't have scars. The way like my generation was sort of like the last chickenpox generation. Like you look at people my age and we have chickenpox scars, and then younger generations no longer have that. That will be amazing if we can achieve that. I will love that. That'll be really, really great. I'm actually going a little bit over, but that's okay because I like the interaction, so I'll hit some of the questions. If I missed your question earlier, just feel free to repeat it. I'll be on for just a few more minutes so I can go through some of that there. Can you do subcision TCA cross, Bellafill, Wallen, Accutane? Yes, you could do all those particular ones. You could do those ones. Lesra is saying, what was used to reduce the scarring in the photo? So we did a few different things. We did TCA cross, we did CO2 laser. Part of it I did a little bit of ablative CO2 laser. Part of it we did with fractionated, and then we also did Bellafill. So I thought I mentioned that, but we also did Bellafill for him as well, which helped a ton. So you really, especially in the temple area, there's not much room there. So if you lose a little bit of your fat just from aging and then you lose it from scarring, it becomes really visible. So doing something like Bellafill is really useful for that. I think that the best result that I potentially had was in my temples was with Bellafill. It was like the difference maker for me. Lilies and Flowers saying Bellafill is amazing. It is amazing, right? Like, I love it. I honestly, I'm glad that more people are aware of it now. I'm glad that like we're hearing more about that because it's awesome. I want that for everybody. I want everybody to feel like there's another option out there. There's things that you could do that could really get you excellent results and stay there and continue to give you an excellent result there. User 84 saying, what are your thoughts on Banish Acne Scar Kit on TikTok? So I do think for like certain like more superficial scars, it's not a bad idea. Like the concept is like stamping. It's not bad. I'm not sure if it's going to give you enough results. It's something that's not particularly too expensive. I think that some of the things that they're doing on top of it, though, like I've seen sometimes they use a pumpkin enzyme mask and other things like that, which I think could potentially break people out. But you could take a look and see yourself. I have a lot of patients who've done it who find that's okay, but like so it's certainly not something that is going to be enough for like these kind of scars. I would say for a lot of patients with more severe scars. Probably not going to change too much with that. Let's see here. User 34 saying, I had a mole. It was removed. I got fat transfer, but I still have an atrophic scar. What can help? Well, the thing is that when it's a localized spot like that, sometimes fat transfer isn't really going to hold enough there because it gets reabsorbed by your body pretty quickly. So something like Bellafill could be an option, or maybe excision. So maybe that's an idea. Dina's saying, would radius tighten pull the neck? The one vertical line that shows some do threads. So yeah, I mean, it's not necessarily like lifting it, but because it gives some volume, and then it also stimulates elastin production, which does tighten the skin. You do get that skin contraction. It does feel a lot better. So over time, it does improve that. And even those lines, it does get. It's not going to help with the vertical lines, though. So I'm not sure which line I'm referring to, but vertical lines, it's not going to help so much. It is going to help more for the horizontal lines. So just hopefully that helps you out with that. RF is saying difference between Radius, Sculptra, and Bellafill for scars. Okay, really good question, actually. I like that question. So the difference between Radius, Sculptra, and Bellafill. Essentially, Radius is a calcium-based product. Sculptra is something that's made out of something called PLLA, which is sort of like a derivative of a form of plastic. Some people say, that it lasts about like 15 months or so in your body, and it gets reabsorbed. And Bellafill is something called PMMA and cow collagen. So it's the only one of these that actually is mixed with actual collagen. So of these, really, there's different reasons to use it. You're talking about more for scar purposes. I would use Radius, especially like dilute form of Radius, more for like patients that have a lot of elasticity issues. So essentially, patients where there's a lot more volume loss, but then on top of it, their skin is actually really loose because of their scars. So imagine now that they had like these tethered bonds over years and years, and they're smiling around those bonds. And as they're smiling, they're pulling the skin around it and stretching out the skin, and that causes more of that causes more laxity in the skin. And then what ends up happening is that over time, you could actually even get some jowling from that. So some patient like that, we may want to use something like Radius, dilute Radius, could work very well for that because it has really excellent elastin production. I love it for that purpose. For collagen response is really good. Elastin production is really good. So you get all that, and it feels and looks really good. Sculptra is a different product. It does give you volume. It's really, really nice as a volumizer. It stimulates collagen production as well. It's a product that I think that if you do it a certain way, could look really, really excellent. But the way some people could do it, they kind of sometimes put a little bit too much in the mid cheek, for example, and it could look a little bit unnatural. The way I tend to do it is very deep a lot of times, and I make sure that we're not really overdoing it really in any location. And I'm really making sure it's spread out and marched along really, really beautifully for patients. So it looks great as people get older and as they age. You're doing it for scars. You're going to do a pretty dilute underneath the scars. And so there is a chance when you're doing it for scars, just for scars, that maybe it could shift and potentially not be in that same pocket there later on. But there's ways of doing it safely and properly, and it really depends on your practitioner. Bellafill, very, very different product. Like I said, essentially it's the only product that's actually mixed with collagen, and so that's mixed with it's collagen and something called PMMA. The PMMA, there's really not any evidence that it really does get absorbed completely in our body. So really the thought is, and I think enough people with ultrasounds can see that a decade later or so, you can still see that Bellafill there. And it likely is more of a permanent product, semi-permanent to permanent product. And it's going to continue to make collagen around the area. So it's a product that's amazing for scars, because now imagine as you lose weight, you always have a scaffold, you always have some support in your scars, so that even as you lose weight, something's going to be there to support it. And it's amazing for that. I love that for that reason. But it has to be done really properly. You have to be really soft with it. You don't want to put too much in it at one time. You really make sure you're constantly moving your cannula as you're doing it, so that way you're never putting it too much in one location. I love it. It's amazing. Like I've talked about before, I have it all over my face, really forehead all the way down. It's an amazing product. Honestly, it really is. I think that it's like one of the biggest difference makers for me personally, and for most of my patients that opt to do it, that I end up seeing like years later. It's like really like very minimal needs to be done in the future, which is awesome. So it's like you kind of like feel like you're more like tired of doing a lot of filler, things like that. It's a wonderful product because there's like a lot of longevity with it, and people don't tend to need as much then in the future then, which is awesome. Maybe different areas, but not so much in that spot then. Really cool that you could do that. Dina saying, apologies that we talk about Bellafill now. Well, we just were answering that question, but if you have another question, I'll be happy to answer it though. Karen is saying, is there an age restriction for phenol peel? Can this be used on darker skin types? Usually phenol is fits 1 through 4. You could do potentially more of a modified phenol in fits 4 and 5, where it's a little bit lighter, but usually it's more fits 1 through 4. Very rare, to do it even for fits 4s, fits 5s, unless it's more severe scars. It really has to be like justified to really do it for that reason. Let's see here. Is it better to perform scar treatments in your early 20s or late 20s? I mean, I do get great results for all age groups. I do, but certainly you could get a little bit more of a collagen response, like this particular patient in his 20s, if you're younger. But also controlling your oil production, making sure you're not smoking. Those are things that really also factor into this, and being good about sun exposure. Cal Ray is saying, hi doctor, what do you do for a deep acne scar that hasn't resolved after many years? Well, let's take a look and see. I mean, I'll be happy to do a consultation. I know someone else was asking about how I do consultations by virtually. You could do it through Zoom, send some photos to me. I'll be able to go through everything really like that. If you want to do a virtual, but come in and we could maybe do something, some patients for the right kind of issue. We could do even some of the same day, or at least get the process starting for you a little bit earlier. Dina is saying, what would you recommend for volume loss in the cheeks and for lips? In the lips, my go-to usually is going to be like more wrestle and kiss. And in the cheeks, it sort of depends. It's like either Bellafill, Sculptra works really well, or a hyaluronic acid filler. If you kind of notice from me, I really do push more like products that are biostimulatory. I really do love that a lot more. Like I said, my own face is full of it. I really am a strong believer in stimulating your body, making sure that you could develop your own natural collagen. I think the results are beautiful. You got, a slower process. Sometimes it's not going to like be right away that you're going to see that result, but over time it looks amazing, and it's really fun to see that. It's like a real great journey for you. So that's what I recommend. I typically push patients to do more like collagen-based products, especially at a certain point when there's loss of collagen. It's a really nice, for that. But if you just want like a little bit of like facial balancing, hyaluronic acid filler usually is my go-to, like something like Restylane Define for more of like the structure, Restylane Lift potentially for that. Do you recommend Bellafill for frown lines? So frown lines, talking about in the center. No, I don't do it in the center area right there. So the 11 lines, that's not a good spot for that. There's too much mechanical movement right there. And I think you run into a little bit of risk with the product potentially getting a little bit too overstimulated with collagen production there, potentially. So I tend not to do it, I just don't do it really over there. But other areas like in the forehead, if a localized spot, some things like that, you potentially could do. Can you get Bellafill when Sculptra has been injected recently? It depends on how much volume loss there is and what we're trying to achieve, but yes, you could. It just depends on what we're trying to look at with that. Real quick, I'll answer a couple things here. What treatment was done in this before and after? So this is TCA Cross. This is with the CO2 laser. This is with Bellafill, and really great improvement there. Really happy. Also, I'm glad more people are kind of aware now of like just collagen stimulating products. It's something that, like I said, like it's amazing. Really couldn't like talk about it, think about it, and kind of go down that route. I know a lot of people get worried about doing, filler, but collagen products are different. And actually, Bobby the esthetician is asking this, and it's a really good question. And Bobby the esthetician is saying, not sure if this is true, but I've heard that Sculptra makes it harder for surgeons to perform facelifts years later. Is Bellafill the same way? So my partner does a lot of facelifts on our patients who have done Bellafill. She has no problem whatsoever with our patients. She feels that it looks and feels just like real natural tissue. That to her, there's no difference. And same with our Sculptra patients. The thing is that there's an aspect here where which we have to pay attention to is where are the people getting these injections done. So sometimes people are doing Sculptra too superficial and they're placing it in areas that it shouldn't be in anyways. I do Sculptra very deep and I don't run into those problems. And I think that's excellent, beautiful results without causing those problems. And, I'm fully aware of what people are saying. The facial plastic surgeons are concerned with it. And I'm aware of that, it's possible that in some hands it could be a problem. But it's also sort of similar to me the way I see like people that burn patients when they do lasers or burn people when they do TCA cross. It's not that, all lasers are bad, all acids like TCA are bad. It's just potentially that the way you did it was not good. It was not done at an appropriate level or the right concentration for that particular patient. And so we can't just like throw away the entire tool. We can't just say that this whole thing just needs to go away because some people just weren't doing it right. There's ways of doing it. And I think I find all these products, especially biostimulatory products, to be really good. Going deep actually to the bone really is nice for a lot of these products, and you really do get more, like not only just that more of that biostimulatory process in the skin, but there's a bit like this growth factor that's occurring in your bone as well that occurs. That is like, it's nice. It's like you get more of like you get to keep more of that shape with the patient's bone even years later. Even if they're losing some bone density elsewhere, you still have that support there. It's really nice. So it just depends on where people are doing it and how they're doing it. And so I think that needs to be factored into, instead of where people say, never do these products because I have problems with it down the line or because there's complications down the line. I think that instead you should say maybe do it differently. Do the technique, use a better technique when you inject Sculptra. And, consider not doing these products if you can't inject it that way. If you weren't trained that way, if you're not comfortable doing it that way, don't do it that way. Maybe these aren't the right products for you. Maybe stick with other products that are easy to dissolve, and maybe not even do like the Juvederm line, which is difficult to dissolve. So maybe do other products like that are easy to dissolve for you. So it's like, then you feel a little bit more comfortable and get your hands a little bit better for that. Let's see here. What would it be recommend for the area around the eye? It's for a friend. Well, usually laser works really well. It depends on what you're referring to. If it's more like indented, if it's volume loss, then something like a filler could work out well. But if it's like more like skin quality, skin texture, laser could work really well there. Let's see here. Stephanie's saying, was that before and after treatment of the pick a painful treatment? No, not at all, actually. Totally. It's like a little bit like essentially or initially people are just anxious. That's the thing that people get concerned with. There's like a little bit of anxiety that happens. Well, we could go through that anxiety, have a lot of tools to help with that, and then you get better there. All right, guys, I went overboard, actually. It was really good, though, really fun. I think it was because of everything else going on election night. Hopefully, this was like a bit of a break from that and less stress in general. And hopefully, we could get some positivity out there and feel better about like just ourselves and just continue to improve and become the best possible version of ourselves. Thank you guys so much. Appreciate you, Dina, too.